Hello. Traction alopecia is a form of hair loss that's caused by a mechanical repeated pulling action on the hair. So if you've got that pulling force consistently against the hair, then unfortunately it causes a form of hair loss called traction alopecia. It's quite a common form of hair loss, and it can affect anybody really. And it's really caused by our hairstyles or choice of hair covering, like a tight helmet. So people often associate traction alopecia with a particular group of people. However, it can affect anyone, any age, male, female. It's really down to what forces are at work on your hair. When I say forces, I'm not talking Star Trek. I mean what form of tension is on your hair and on the roots. So if someone's got a tight ponytail, like we often see in children of all ethnicities, and where that's repeated, sadly, children can then develop traction alopecia, affecting their hair edges or wherever that tension is. So another group of people that can develop this would be ballerinas. Classically, you see them in one type of hairstyle, so it's pulled up quite tight, it looks really beautiful. However, repeated styling in that way can cause traction alopecia, and most dancers start dancing from a really young age, don't they? And so they keep that hairstyle for a long time. So you have that combination of a repeated pull effect over one area of the scalp, and over time that can develop into traction alopecia, and even worse, it becomes a form of traction alopecia that is then not reversible. Another interesting group to think about would be men who would, maybe for cultural, traditional, or religious reasons, would have their hair pulled up tightly up underneath a hair covering. So I think quite often we quote Sikh men may develop traction alopecia off the scalp or even off the beard. So it's wherever you've got hairs, repeated tension, a repeated pulling action that's not, even if you stop it for a day and then you continue again for a few weeks, that repeated pull can cause traction alopecia, so hair loss in that region. Well, do you know, there's something we can all do. One is stop the pulling effect, so change your hairstyle. I think we can get, really comfortable with a particular type of hairstyle. It looks really good, but then we forget about the hair roots, the follicles. So for myself, for example, if I'm doing tight braids, tight cornrows, well, I used to, now I don't, because of just the awareness of the fact that my beautiful hairstyle may cause hair loss if it's not done properly. So people can still wear extensions, you can still braid your hair, you can still put your hair up in a ponytail, but don't do it tightly and don't do it repeatedly. Change your hairstyle. It's worth at this point mentioning there's certain things that we do as well, maybe wearing tight hairbands, tight helmets. Again, that can have a pulling force on one area of the scalp, one area of the hair, and lead to traction alopecia. If you're concerned about your hair thinning, hair loss, or you notice hair loss in patches, it's worth ask the question, ask it early, seek specialist advice, or they're usually things that can be done, except most people aren't aware of it because it's not the most important thing in our diary. And then sadly, people leave it till it's too late. It's worth at this point stating that traction alopecia, we said before, alopecia means hair loss. So the pulling effect causing hair loss can be reversed if we change how we style our hair. However, if the repeated pull effect has been left for a long time, one develops an irreversible form, or one can develop an irreversible form of traction alopecia, and which means actually the follicles are then so affected that the hair does not regrow. At that stage, if you've got gaps in your hair where the hair is not regrowing, medication may not be enough. And so a hair transplant or hair restoration procedure is what you need to consider. Again, I would say dealing with things sooner rather than later is better, because then you can discover, all your options and take things forward from there. So it can be stopped, and hair regrowth can be re-stimulated. I sound like a broken record, but it's stop the tight hairstyle, get rid of the, well, no, actually, don't get rid of the helmet. Get a good fitting helmet that's not overly tight. Yes, so we can prevent further hair loss. If the follicles are gone, we can correct that with hair transplant surgery. And actually, in some cases, if it's not reached the irreversible stage, that is the scarring stage, using medication like minoxidil and some other options may help to re-stimulate the hair growth. In a lot of women and men, actually, people notice perhaps the edges of their hair is not regrowing as much as it can. So that may be because of traction alopecia. I would say get a consultation, find out what the underlying cause of your hair loss is. It may be a mixture of things. It may just be traction alopecia. And if the case, if caught early, it's potentially reversible. And in that term, you can call it being cured, if the repeated tension recurs, then sadly, it can happen again, whether you've had a hair transplant or not. Yeah, so treatment options outside of preventing the hair loss is medical treatments, including minoxidil. That's just to re-stimulate the hair follicles, dormant hair follicles, to start growing hair again. If, however, they're permanently damaged, a hair transplantation is an option. Actually, there are a few other things, but I would say it's worth seeing a specialist so that the treatment can be tailored to your situation and you can get a bespoke plan made for yourself.